Hello again, Mike Gooden with Reduced Risk Retirement Solutions. We are a certified financial fiduciary with 20 years of experience helping people keep their money, grow their money, pass their money to their heirs. In this video, we're going to talk about Medicare, all the parts of Medicare, parts A, B, C, and D, what each one of them does, what it covers, and the costs associated with each one. This is important stuff to know when you're transitioning into Medicare so you can make a good decision on whatever supplemental coverage you might get to go along with original Medicare. Because original Medicare, remember, that's going to pay for 80% of your Medicare services, leaving you on the hook for the other 20% of services, of the costs of services. And that's why things like Medicare Advantage plans and Medicare supplements exist to help cover that 20% of medical costs that original Medicare just by itself does not cover. So Medicare Part A is your hospital insurance. That primarily covers inpatient care and hospital stays, skilled nursing facility care, hospice, as long as it's prescribed by a doctor. So it's essentially paying for services received as an inpatient after a doctor's order. The good news about Medicare Part A is that the vast majority of Americans have worked and paid Medicare taxes for more than 10 years or 40 quarters, which means they get Medicare Part A for free. Yay! If you have worked 30 to 39 quarters, 7.5 to 10 years, you will pay $311 a month for your Medicare Part A premium. So if you're right at 38 or 39 quarters, boy, I would strongly suggest, if you can, continue working for another 3 or 6 months so you can get that free Medicare Part A and not have to pay $3,600 a year for it. And then if you've worked fewer than 30 quarters, less than 7.5 years, you're going to pay $565 a month for your Medicare Part A. There are deductibles and coinsurance associated with Medicare Part A, but very important to note that most Medicare Advantage and supplement plans greatly reduce or completely cover your Part A deductibles and coinsurance. So again, important to work with a qualified Medicare professional to make sure that you get on a plan that's going to save you the most money and cover all of those deductibles and coinsurance. Because if not, if you're just on original Medicare, you're going to have a $1,736 deductible per benefit period. Benefit period is a year, so it's $1,736 per year for inpatient hospital stays. And then there's coinsurance involved with Medicare Part A as well. After you pay the deductible, you will fortunately only pay $0 for days 1 through 60 in a hospital. And then you'll pay $434 per day for days 61 through 90 and $868 per day for each of your 60 lifetime reserve days. I'll tell you, though, in my experience with my family, I've never seen anybody stay in a hospital for more than about 5 or 6 days. It didn't matter how sick or injured or in bad shape my parents were. Whenever they showed up to a hospital, they got kicked out to skilled nursing within about 5 or 6 days, even if they were having surgeries, etc. But there's also coinsurance associated with skilled nursing facilities. Again, $0 for days 1 through 20, but then $217 per day for days 21 through 100 if you're just on original Medicare by itself. Again, a good Medicare Advantage or supplement plan is going to take care of all those costs for you. Medicare Part B covers medically necessary doctor's services, things like doctor's office visits, outpatient care, durable medical equipment, walkers, crutches, wheelchairs, mental health services, ambulance and emergency room services, and all of your preventive services like your annual wellness visit, your flu shots and vaccines, love them or hate them, that's all taken care of under Medicare Part B, and things like cancer screenings and mammograms. So Medicare Part B is a pretty big deal. There is a deductible, annual deductible for Medicare Part B in 2026 is $283. So the first couple times you go see your doctor in 2026, you're going to pay out of pocket until you've reached $283. And then all of the copays and things like that will kick in. Your Medicare Advantage or supplement plan will start paying for all those costs. There's coinsurance involved with Medicare Part B. Again, if you're on original Medicare with no supplement or Advantage plan, you're going to pay 20% of the Medicare approved amount for all of those Medicare Part B services. So if your doctor customarily charges $500 for an appointment, and you don't have an Advantage plan or a supplement, you're going to pay $100 every time you go see your doctor. If you need a surgery and that surgery costs $100,000, you're going to pay $20,000 out of your pocket for that surgery. If you've got a Medicare Advantage or Medicare supplement plan, they are there to cover that 20% of out-of-pocket costs that original Medicare does not cover. There's monthly premiums for Medicare Part B. In 2026, the standard Medicare Part B monthly premium is $202.90 per month. That amount will be higher for individuals that have higher incomes because they will base your Medicare Part B premium on income from the 2 prior years. I talk about that a little bit more on the next slide. But I want to make sure that everybody knows that once you start paying your Medicare Part B premiums, you always have to pay it. So the best way to do that, and the vast majority of people do it this way, just have it automatically deducted from your Social Security or railroad pension benefit. That helps prevent lapses in coverage and any penalties that might come with a lapse in coverage. Definitely the easiest way to do it. If you have done a very good job of saving for retirement and you're going to have a healthy retirement income, congratulations on that. But you might earn yourself slightly higher Medicare Part B premiums. This is part of the reason why a lot of people are looking at Roth conversions these days. That's something that we help people with. It will lower people's Medicare Part B premiums during retirement. Because if you're making above, if you're making above $109,000 as an individual or $218,000 as a couple, you see you're paying about $82 more per month for your Part B premium. And then, very wealthy folks, you've got an income above 500,000 taxable income as an individual or 750 as a couple, you can get up to be paying close to $700 per month. So remember, that's all based on taxable income. And so those with substantial pre-tax retirement savings may want to consider a Roth conversion, not only to help lower taxes in retirement, but also help lower those Medicare IRMA premiums before the IRS required minimum distributions hit at age 73 to 75. Medicare Part C and Medicare Part D, neither of them existed before 2006. They were all implemented as part of the 2006 federal Medicare overhaul. And so Medicare Part C simply refers to Medicare Advantage plans. They didn't exist before 2006. And the Medicare Advantage plans help cover the 20% of out-of-pocket costs that original Medicare doesn't cover. Medicare Part D is your prescription drug plan. And again, it did not exist before 2006. Medicare prescription drug plans are offered by private insurance companies, just like Medicare Advantage plans. With a Medicare Advantage plan and Part D plan, those private insurance companies are the administrators of those benefits. And the Part D plan, of course, prescription drug plan, that helps cover your prescription drug out-of-pocket costs that original Medicare does not cover. So again, how does reduced risk help? We are a fiduciary independent broker, not obligated to place any individual in any specific plan, but very much obligated to put people in the plan that has the best benefits and the lowest costs for them as an individual. And we help you ensure get the most benefits for the least amount of dollars and avoid any and all enrollment penalties. There's no charge for our services. We get paid by the insurance companies to enroll people into their plans, and we track the enrollments to ensure plan effective date and verify enrollment. And then finally, most importantly, we act as an advocate on behalf of our clients. If you're having a problem with the way that your Medicare insurance company is paying your benefits and covering your benefits, call us and let us know. We will call up the health plan and yell at them on your behalf and figure out what's going on. So go to our website, give us a call, www.reducedrisk.biz or 707-888-5723, and schedule an appointment.